Hi, my name is Peter Hunt-Spitek, and today we're taking to the streets of North Central College to try and gauge what the students know about the coronavirus and hopefully clarify some misconceptions that are going around. So, what is the coronavirus?
To me personally, coronavirus is just, it's like a small little flake of the flu, but a little worse because it's traveling rapid. It's like on a world tour right now, going from state to state, country to country. So I think it's crazy. It's just gotta be mindful of that.
It is a virus from China, I think.
I don't know. I think it's airborne. It's just like a virus. That is the best definition that I have for you. It's on my bottom of priorities at the moment.
If you're unaware, the novel or new coronavirus is a respiratory disease first detected in China, which has now been observed in more than 100 locations internationally. The virus has been named SARS-CoV-2, and the disease it causes has been called the coronavirus disease 2019, often abbreviated as COVID-19, or simply the coronavirus. So, how's it spread?
Through like bacteria, so like you touch it. Well, if someone else has like corona, they touch you, or you touch your face with like other bacteria, like on doors or whatever, and yeah, you get it.
It can spread through the air and through person-to-person contact. From what I've heard, it doesn't seem to be lasting on surfaces very long.
Through the air. I'm pretty sure through other bodily fluids as well. I would assume that, just from like what I know on viruses and stuff.
The virus is mainly spread through person-to-person contact, particularly among people who are in close contact, roughly 6 feet to one another. It's spread through respiratory droplets, or fluids produced by coughing or sneezing. How often asymptomatic transmission is occurring is unclear at this time. So you're probably wondering, well, what are the symptoms?
Things like fever seems to be one of the biggest symptoms too, along with coughing, sometimes sneezing as well, and then just like general things like fatigue. I think those are kind of the main ones.
I'm gonna say lightheaded, I'm gonna say fatigue, coughing, sneezing, anything that's very similar to flu-like symptoms. So if you have the flu, you pretty much have the coronavirus now. That's how bad it is.
I don't know. I'm gonna say like coughing, probably, but I don't know.
Like lethargy, feeling weak. Otherwise, they're pretty much mirror like the flu symptoms. So, coughing, fever.
I believe it has like a 2-week incubation period, and I think after that, it's some respiratory, like really intense respiratory issues, and coughing, probably. Yep.
The coronavirus shares many commonalities with the common cold and seasonal flu. Symptoms may appear between 2 and 14 days after exposure, and it's important to know the differences between symptoms of a cold, allergies, the flu, or the coronavirus. So symptoms for a cold or allergies look like itchy eyes, a stuffy nose, or sneezing. The flu or coronavirus symptoms might be a fever, fatigue, body aches, cough, or shortness of breath. And on top of that, worsening symptoms. Other things to look out for the coronavirus is a history of travel or exposure to infected individuals. But who might be susceptible to catching the coronavirus?
I think we all are, but the people who are not most likely to make it, unfortunately, are people that are elder. I would say senior citizens mostly.
It's not young people like how we would think, but it's the older population and then, people who are immunocompromised in any way.
Young children, old people, and people with autoimmune deficiencies or other like life-threatening medical conditions.
People who are at a higher risk of catching the coronavirus are older adults, people who have serious chronic medical conditions such as heart disease, diabetes, and lung disease, and people with compromised immune systems. But what's the fatality rate for the coronavirus?
They say kind of in total it hasn't been a really large fatality rate, but it probably depends too on just the number of cases as well. Yeah.
It was around 2% a couple weeks ago. I think it's actually a bit lower now because there's more symptom-based reporting and more cases.
So I would say like fatality rate, like maybe someone who gets it in that category, like 60%.
As of March 11th, the World Health Organization has announced that the coronavirus has reached a 3.4% fatality rate. This is a high rate when compared to the seasonal flu, which on average only produces a 0.1% fatality rate. But how can you prevent it?
Simple hygiene, luck.
So things like just washing your hands a lot. I know a lot of guidelines now around really emphasizing like washing your hands for 20 seconds, and they have a lot of things about like, well, they're singing a song in your head like Happy Birthday or some other song. Increasing use of hand sanitizer if you're not able to wash your hands. Masks might not be all that effective, so try to minimize mask use unless you yourself are showing symptoms, or if you're caring for somebody who also is symptomatic.
Disinfect everything, doorknobs, handles, everything. Gloves, as you can see, these gloves right here, perfect.
I'd wash my hands, and when you like touch door handles, try to like not like directly touch them. You can like find other ways, like use your sweater or whatever you got.
There is currently no vaccine to prevent the coronavirus, but according to the CDC, the best way to prevent the illness is to avoid being exposed to the virus. Simple. I know. To protect yourself, wash your hands often with soap and water for at least 20 seconds. If soap and water aren't readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. To protect others, make sure you stay home if you're sick and cover coughs and sneezes with a tissue or the corner of your elbow. If you are sick, make sure to wear a face mask when around other people. You don't need to wear a face mask if you're not sick, unless you're caring for someone who is. Face masks are in short supply right now and should be saved for caregivers. How concerned are you about it?
I'm kind of demonstrating just like a healthy amount of concern, where I am trying to increase like these individual kind of preventive approaches, like washing my hands more, like even just getting out of class, I went and washed my hands even though I didn't really think I needed to, but trying to be a little bit more proactive about that, using hand sanitizer. But I also don't want to let myself spiral into like, this is the end of the world sort of deal.
I'm not concerned because apparently it's not impacting like us, like middle-aged people right now.
I'm not concerned. I survive it, so I'm not concerned about it.
No, but in the way that I could spread it to people who are at risk, yes.
I am not very concerned. I'm concerned for the people that it is affecting, so I definitely am concerned about that. But me personally, I think my immune system is pretty up to date right now.
I think it's important, but knowing my place in the chain of risk, I think I have other priorities that are kind of stressing me out a bit more.
Worry and concern are valid emotions to be feeling when a global epidemic is happening. This is serious, but remember that panic doesn't help anyone. You can help by keeping a cool head and following our prevention tips. Between filming and editing this video, all students from North Central received an email from President Hammond saying that all in-person classes have been suspended through the remainder of the spring semester. While parts of the campus will stay open, gatherings of over 100 people have been prohibited. So if you're a student and waiting for details about your classes, make sure that you're checking your emails for updates from your professors. The coronavirus is scary, but preparation and knowledge can make it a whole lot less scary. Remember to wash your hands and maybe skip the handshake and replace it with a good old-fashioned Vulcan salute. For NCC Linked, I'm Peter Hunspitek reporting.